Hi, I'm Dr. Nandhan Kumar. I'm a consultant physiotherapist. I've been in this profession for the last 25 years. I graduated from the Kasturba Medical College, Manipal. I've done my master's in physiotherapy, especially in cardiopulmonary physiotherapy. Uh, and I have seen this profession grow in the last 25 years. And I have own physiotherapy and rehabilitation center in JP Nagar. And I specialize now in treating orthopedic cases, neurological cases, and I also treat cardiopulmonary rehabilitation. Initially, when I started my practice 25 years ago, our even medical sciences has grown in the last 25 years. So when we started, we were only dealing with patients who are undergoing open surgeries. Arthroscopy was still in its nascent stage. So physiotherapy, again, there were not many physiotherapists 25 years ago to bring about an awareness among people. So with the development of medical sciences, physiotherapy has also grown. So there are more surgeries which are done, and more rehabilitation techniques have come. More new physiotherapy equipments have come which can focus on assessment and treatment of patients. So the field has changed a lot, and especially technology has played a huge role in changing this field. See, sitting for long hours has been a challenge, and you can't avoid it, especially with the present software industry where a lot of people are employed, where you have to sit for long duration. It is also said that sitting is the new smoking. So sitting causes a lot of injuries, and most common injuries sitting causes is back pain and neck pain. It's because of poor ergonomics. Ergonomics is separately a field itself in physiotherapy. So poor ergonomics has contributed to a lot of back and neck problems among especially people who work in front of the computer systems. So the only way is take frequent breaks, exercise regularly, keep a close watch on your diet, and make sure that your metabolic health, that is, you are free from diabetes, hypertension, and you do things where you are free from all these diseases, and exercise regularly, and you will definitely be better. See, most important, especially when you are going to a gym, first when you're going to start your exercise program, either joining a gym or a yoga class, it's always better you consult a physiotherapist or a doctor to make sure that you are fit to do exercises rather than you try to do exercises to be fit. Because to prevent injuries, you need to have a complete assessment of your body type, whether you're fit enough to start an exercise program. So I would always suggest you to consult a doctor and a physiotherapist before you start your exercise journey. Yes, during your exercise journey you may be injured, and but these injuries can always be taken care of by consulting your physiotherapist, and the right type of exercise needs to be done for your body type, and your physiotherapist will be able to help you on that. All surgical interventions at present in a multi-specialty hospital, a physiotherapy department is always there. Any patient who undergoes surgery, the physiotherapy is started as soon as the patient is shifted out onto the recovery room. So the reason is early mobilization of a patient. The faster you get the patient on their feet and start moving, the lesser is the number of days the patient spends in the hospital, and the faster he will recover from his wound, or faster he will recover and get back to his work, or faster he'll get back to whatever he likes to do, like play or get back to exercise. So physiotherapy plays a very important role in making the entire journey as smooth as possible, especially so if you have undergone most of the orthopedic surgeries, and also very important for patients who have undergone major cardiac surgeries. Also physiotherapy plays a very important role in getting them back on their feet as soon as possible. See, pediatrics and geriatrics, they are two ends of our the health. We are treating with young children and we are treating with elderly people. I will split it up into two things. Pediatric rehab is very important because most of the children who are born because of a birth injury during their birth time, or when they're during the pregnancy time, uh, problems like cerebral palsy and most of this developmental delays are all commonly seen among pediatric children. So they require specialized physiotherapy approaches. So it's not like a one size fits all. So a tailor made physiotherapy program has to be done for children. Similarly, geriatrics, we have a considerable amount of elderly population who want to be mobile and active. So there are a lot of centers which are opening up now, which provide assisted living and active aging. They say so. Physiotherapists help in improving that. You maintain your mobility for as long and even till the age of 100 years. So if you're living till 100, you should be able to get up by yourself, use the washroom, and do most of your functional activities independent. So physiotherapy should aim at functional independence, especially for geriatric age group. Yes, physiotherapy now, the recent government guidelines have they have standardized the physiotherapy education. That's very good. So at present, physiotherapy, when you want to enter into the field of physiotherapy, is a 5-year course according to the new policies of education in physiotherapy, followed by a 2-year master's specialization. You can choose whichever specialization which interests you. So it's a 7 years of continuous study, a very intensive program. So I would say that young generation have a huge opportunity for physiotherapists, because still the number of physiotherapists in the country is much lesser than the number of patients who require services. Especially so, it is in tier 2 and tier 3 cities where the penetration of physiotherapy is very less. So especially in the rural areas, we need physiotherapy because this is where the future lies. Awareness to the public, there are three things. One, stay fit, be as active as possible, and next, always consult a physiotherapist before you start an exercise program. It will prevent you from getting injured. And thank you very much for the iOrbit team. You have come here and you have taken an interview, and you are using this as a platform for promoting physiotherapy. I wish you all the best for the entire iOrbit team. I've been associated with them for quite some time, and I've been advising them for a lot of other things. So all the best to you, and thank you very much.